Temporary loss of consciousness. Temporary loss of consciousness, a partial or complete loss of consciousness with interruption of awareness of oneself and one's surroundings. When the loss of consciousness is temporary and there is spontaneous recovery, it is referred to as syncope, or, in non-medical quarters, fainting. Syncope accounts for nearly 1 in every 30 visits to an emergency room. Syncope is due to a temporary reduction in blood flow, and therefore a shortage of oxygen to the brain. This leads to lightheadedness or a blackout episode, a loss of consciousness. Temporary impairment of the blood supply to the brain can be caused by heart conditions, and by conditions that do not directly involve the heart. Non-cardiac causes. Syncope is most commonly caused by conditions that do not directly involve the heart. These conditions include cardiac causes, heart conditions that can cause syncope, or fainting due to temporary loss of consciousness include, to be sure, many of the causes of temporary loss of consciousness can be detected by a careful history. Dizziness after standing up in an older person suggests postural hypotension. Temporary loss of consciousness after urinating, defecating, or coughing suggests situational syncope. Cardiac causes of temporary loss of consciousness such as aortic stenosis or cardiomyopathy are suggested by the occurrence of the event during exercise. Signs of weakness localized to certain areas of the body with temporary loss of consciousness suggest stroke. Temporary loss of consciousness.